Today I'm talking to Dr Bruce Willett about the things he's learned during the COVID pandemic and some of his thoughts about the future.
We've done incredibly well in this country, and that's really been a team effort throughout the whole of the country. You know, the state and federal governments have worked really well together and really efficiently. I think general practice has really stepped up and done super well. And then the whole community has really got on board in a way that I don't think anyone really expected. And the results have really spoken for themselves, and compared to countries with equivalent health systems, equivalent levels of development, you know, the way we, you know, performed through this whole crisis has been extraordinary.
What have practices got right?
The ability to stay open for business, to continue to see patients face to face, as well as provide telehealth and get the systems in for telehealth, you know, really quickly within days, was extraordinary. The ability to make patients to feel safe going to their general practice, to have the processes in place to screen out patients who might have infections, to have strict hygiene processes in place, and to, you know, have the social distancing within their waiting room. All of that basically rolled out within hours or days rather than weeks, and you know, I think GPs are to be congratulated for that.
They worked hard and fast.
And it was difficult for a while there. There was a while there that all the rules were changing every day or two, and so all the systems in the practice had to be rejigged and reorganised, and that had to be communicated, and everyone had to get on board, you know, twice a week, and that was tough.
Yeah. So there's been a lot of telehealth picked up and used really swiftly as a tool. How do you think practices can make the most of telehealth? What does really good health care look like through those tools?
Yeah, so telehealth has been a boon for patients. Patients have loved it, and it's increased the accessibility of some patients who would not have had the same sort of accessibility to services. So the challenge is, how do we integrate telehealth into a whole patient-centred approach to care? It needs to be linked to a patient's regular practitioner, and it needs to be linked to the ability to have those face-to-face and for patients to be examined when they need to. So in terms of what makes good telehealth is often realising when it's not appropriate.
What are our next steps?
So super important to say that we're not at the end of this. I actually heard a radio announcer saying, now that the pandemic is over, which was terrifying, it's certainly not over. We're in a containment phase. We're in a phase where we're very unlikely to eliminate this. I mean, I know there are people there hoping that we will. It's very unlikely, in my opinion, that it'll be eliminated. So it's about controlling it. It's about identifying cases early and ring-fencing those cases. The emphasis has to be on testing, and if someone has any sort of respiratory symptoms, we need to have a really good reason why we're not testing that person rather than why we are testing them. In the long term, I think probably the main danger is actually complacency. We are not over this. There's a knife edge. It would not take much for a number of cases to get out of control that can no longer be controlled, and we could be still looking at the sort of scenarios that we're all terrified about in February. So still maintaining that ongoing planning, thinking about what if, what will we do if things get worse, you know, how are we handling PPE, what things will we be doing in terms of hygiene in the practice, and what will we be doing in terms of staffing in the practice if things do get worse, because there's starting to be a little feeling that we've got this, and for now we do, but only just.
Thank you very much for those insights, Bruce. There's a lot for us to think about and a lot left for us to do. And thank you. See you next time.